Welcome to the first aid training course. My name is Dr. Yvette Turugari, and today we are going to talk about management of wounds. So a wound is a break in the continuity of skin, and it occurs secondary to an injury. It can be classified into a laceration, a bruise, or a contusion depending on the nature of the injury. So today we are going to demonstrate the management of wounds. So in first aid we use a triangular bandage, the one that I'm holding. So firstly, before we discuss the management of a specific wound, we want to make a narrow folded bandage and a broad folded bandage from this triangular bandage. So this is how you make a broad folded bandage from a triangular bandage. You hold your triangular bandage like I'm doing with the bases, then you put the tip of your triangle at your knee and the base towards your waist. Then you fold it the first time like this, then again the second time, then you get your broad folded bandage. So this is the broad folded bandage. For us to have a narrow folded bandage, we then fold the broad folded bandage again like this. So this is our narrow folded bandage. So going on to the management of wounds, this patient has a wound on this part of the arm. So we want to manage the wound accordingly. So the basic principles involve cleaning the wound so that we remove all the foreign bodies. So you have to wash the area with the wound on running water for at least a minute so that it becomes clean. And also we need to apply pressure. And the way we apply pressure is that we make a pad using the narrow folded bandage. And applying pressure helps in arresting the bleeding and reducing the pain. So making a pad from a narrow folded bandage, you fold it as many times as possible depending on the size of the wound. Then you apply the pad on the wound to apply pressure to arrest bleeding. Then you take another narrow folded bandage and then you bandage your wound. So this is how you do the bandaging of the wound. We need to make sure the wound is covered totally with the bandage and the pad is directly on top of the wound. So when you get to this point, you then want to tie what we call a reef knot. This is the knot that we use in first aid. So a reef knot, you tie it using the ends of the bandage that are in your hands. So this is the left part and this is the right part. You take the left part, then you put it over the right and under. Then you tie. You have to make sure that the tie is directly on top of the wound so that you arrest bleeding. Then the next part, you take the right and you put it over the left and then you tie again securely. Then you have to secure all the free edges of your bandage inside so that the bandaging is smart. So this is how you manage a wound. So going on to the specific management of wounds, if a casualty has a cut across the palm, like in this casualty, you want to make sure that the casualty avoids overstretching their palm like this because it will cause excessive bleeding from the wound. So like what we demonstrated before, you need to wash the wound with running water for at least a minute. And when the wound is clean and there are no foreign bodies, you need to apply pressure using a pad. And when you apply pressure, make sure your casualty bend their palm so that they apply pressure to the injured part and they are not stretching their palm. Then you apply your bandage. When applying the bandage, you need to make sure that the thumb is exposed so that you assess circulation. I will show you how to assess circulation after I do the bandaging. So this is how you do the bandaging. So you have to make sure that you are applying pressure to the injured part and the thumb is exposed so that you assess the circulation at the end. Like we demonstrated before, again we tie a reef knot on top of the wound so that we apply pressure as well. You take the left, then you put it over the right and under, then you tie, then the right over the left and under, then you tie. Then again you need to secure the free edges of your bandages like this. Then after tying, you need to assess the circulation like I mentioned before on the thumb. You need to check if you press, there's what we call capillary review. If you press, the red part of the nail bed is supposed to come back after pressing instantly. So if you press and the red part comes back instantly, you know the circulation is okay. But if you press and it takes more than 2 or 3 seconds, you know that the circulation is compromised. You have to untie your bandage and make it a little bit loose. Now going on to management of a cut along the palm. So like the other management of the other wounds, we need to apply the general principles first. You need to wash the wound on running water for at least a minute to make sure there are no foreign bodies and the wound is clean. Then we need to apply pressure, and in this case we apply pressure by putting the pad and making sure that the casualty touches the pad with their thumb and applies pressure, and the other 4 fingers are outstretched to avoid over bleeding. Then you need to bandage like we did before, but when you are bandaging, you need to make sure that the tips of these 4 fingers are exposed for circulation assessment, which I will demonstrate after bandaging. So this is how you bandage. You need to make sure that you apply enough pressure to reduce bleeding, and you make sure that the pad is covered with the bandage and the tips of the 4 fingers are exposed. Then you need to tie your reef knot on top of the bleeding area. Then you take your left over right and under. Then you tie right over left and under. Then you tie. Then you need to secure the free edges of your bandage like this. And again, you need to assess for circulation in the tips of these fingers that are exposed. So you go to your nail bed, place a little bit and see if the red color comes back instantly. If the red color is not coming back instantly, you know that your circulation is compromised. You need to remove the bandage and tie again a little bit loose. Thank you. In this module, we learned 4 things. The first one, we learned how to make a narrow folded bandage from a triangular bandage. The second thing is the general management principles of wounds, which include cleaning the wound so that we remove all foreign bodies and the wound is clean, applying pressure to the bleeding wound to reduce bleeding and reduce pain, and assessing the circulation after tying a bandage on a bleeding wound. Thank you.